A facelift is a cosmetic surgical procedure to create a younger appearance in your face. The procedure can reduce the sagging or folds of skin on the cheeks and jawline and other changes in the shape of your face that occur with age. The incised areas are outlined and opened. With the help of a scissor, the underlying tissue is released. The incision is further opened in order to incise the fascia, which is pulled and sutured. Skin areas are trimmed and also pulled closed. A neck lift enhances the appearance of the neck by tightening the skin and underlying neck muscles and improving the contour of the jawline. The procedure is often performed in conjunction with liposuction, a facelift, or a cheek lift, but may also be done as a standalone procedure. Sometimes the submandibular gland is also excised as a part of the procedure. LASIK can be an alternative to glasses or contact lenses. During LASIK surgery, a special type of cutting laser is used to precisely change the shape of the dome-shaped clear tissue at the front of your eye, that is cornea, in order to improve vision. A corneal flap is cut and flipped open like a cover of a book. A precise and controlled removal of corneal tissue by a special excimer laser reshapes the cornea, changing its focusing power. The corneal flap is then replaced like closing the cover of a book. Blepharoplasty is a type of eyelid surgery. It can improve the eyelid's function and appearance by making specific changes to the skin, fat, or muscle. During blepharoplasty for the upper eyelid, the surgeon makes an opening within the natural crease on the lid. Then he removes the excessive skin and, if required, excessive muscle, and he may also remove or reposition the fat. For the lower lid, the surgeon often makes an opening just below the lower eyelash line. The excessive skin is removed and the fat may be repositioned. Sometimes the incision is made inside the lower eyelid in order to redistribute the fat. The incisions are then closed with stitches or surgical adhesive. Dental veneers are sheets made of different materials that allow us to correct small tooth defects, both in form and size and color. It partially covers the tooth that must be previously prepared. With them, we can achieve excellent aesthetic results, getting significant aesthetic changes to the patient. Each case requires a previous analysis where the smile and tooth position, lips, gums, and all tissues of the face in general are evaluated. Once the case is analyzed, a personalized treatment is performed. For its placement, the affected teeth must be previously prepared. The tooth surface is then acid etched for a few seconds and then washed with water. The veneers are then prepared according to the needs of the patient. After then, they are placed on the prepared teeth. And finally, they are light cured to finalize their adhesion to the teeth, resulting in a beautiful smile that everyone wants. Rhinoplasty, often called a nose job, is a surgery that changes the shape of the nose. The motivation for rhinoplasty may be to change the appearance of the nose, improve breathing, or both. If you are a candidate for surgery, your surgeon will develop a customized plan for you. It may be done inside your nose or through a small external cut at the base of your nose between your nostrils. The surgeon will likely readjust the bone and cartilage underneath your skin depending on how much needs to be removed or added, your nose structure, and available materials. A graft may be required from inside your nose or even your rib. After appropriate changes are made, the surgeon places the nose skin and tissue back and stitches the incision in your nose. Liposuction of the face and neck works the same way as liposuction of other areas. For removing excess fat through the intended area, the surgeon will make 1 or 2 small incisions. Then small tubes are inserted in the surgical sites in order to remove the excess fat. The surgical sites are then closed and sutured. Follicular unit extraction is a new, minimally invasive hair transplant technique. While using this technique, the area on the back of the head which is healthy is shaved. Each of the follicular unit is then removed individually using a special instrument with high precision and minimal transaction. The slits are then prepared taking utmost care of the direction and density. After all the follicles are prepared, they are inserted one by one. This ensures that no follicle gets damaged. These grafts are then implanted on the bald area. On average, it takes 4 to 6 months for the transplanted hair to start growing. Results are natural, permanent, and life-changing. Lasers is one of the best ways to address many of the most common skin concerns, including sunspots, age spots, wrinkles, rosacea, redness, acne scars, and even acne itself, besides removal of excessive hair. There is an abundance of effective lasers available to treat these skin concerns. Laser genesis is known as one of the best lunchtime cosmetic procedures because you can leave the dermatology office looking better already. It boosts collagen production to rid of fine lines and wrinkles and give the complexion a beautiful glow. Fractional CO2 laser will poke teeny tiny holes into the deepest layer of the skin to regenerate collagen growth and fill in the areas of tissue loss due to acne scars. Pulsed dye lasers use yellow light to very gently heat up the skin and destroy broken blood vessels while leaving any surrounded skin untouched. Treatment of crow's feet, sun damage, melanin spots, as well as excessive hair can also be done with lasers. Botulinum toxin, often called as Botox, is produced by a specific type of bacteria. When botulinum toxin is injected, it blocks certain nerve signals that make muscles contract. The muscles then relax, reducing unwanted wrinkles. This effect lasts for about 3 to 6 months. After then, the Botox needs to be repeated. For people with poor chin projection, the surgeons can perform a sliding genioplasty, also known as the chin augmentation surgery. Retention plates are then used to permanently reposition the bone. The procedure takes about only 60 minutes. So guys, these are only some of the facial cosmetic procedures that are being performed nowadays. If you like this video, make sure to give a thumbs up and hit the subscribe button so you never miss one of my videos again. Take care.